This is Dr. Sargisian, and today we'll talk about adult respiratory diseases and disorders. And I would like to skip the childhood disorders as I talked in review. It will be very small portion, and I'd like for you to review those independently at this time. When we start talking about these diseases, we need to know signs and symptoms, and it's basically a review of your Bachelor's of Nursing programs, the materials from there, but just very quick review. Dyspnea, orthopnea, apnea, wheezing, and coughing, nasal discharge. These are the signs and symptoms you will see patients in primary care most of the time. And we know that in hospital, the signs and symptoms can become more and more dramatic. But in primary care, these diseases most of the time are very benign and self-limiting, hopefully. But again, when the acuity of the disease changes, certainly you have to be more prepared to treat more life-threatening disorders. Auscultation is important in diagnosing respiratory diseases, and you can go from assessing breathing quality and rates such as labored, unlabored, rate of tach apnea, and of course we'll know that this may represent rapid respirations. Rapid respirations per se may be related to other than respiratory diseases. However, this may result in hyperventilation and related respiratory alkalosis. So as you all know, that this is the basics of respiratory disease description. However, I included it here to show you that this may be also related to life-threatening consequences. When we auscultate the patient, and we can hear the different sounds and bronchi, which are rattling sounds due to obstruction. Rales, also known as crackles, it comes from French râler, and crackles also may signify the pulmonary congestion and may have critical significance in your assessment as we're talking about respiratory diseases. In primary care, they may signify chronic condition. However, crackles are not a normal situation, even with for someone with history of respiratory diseases, and most of the time it may signify something other than purely respiratory conditions such as congestive heart failure. Wheezes are wheezing sounds, and to determine or to describe this correctly and know what wheeze is, you need to remember that wheeze is a musical sound. You can play a tune with wheezes, as bad as it sounds, but wheezes are musical sounds. They have a tone. They are not noises like bronchi or rales. What you can do to diagnose: chest x-ray is golden standard and the beginning of the diagnosis for respiratory conditions. At the same time, it's very affordable diagnostic tool and can reveal many different respiratory disorders. Sputum culture is rather unorthodox diagnostic tool in primary care. However, it's quite often used in hospital setting. Of course, sputum culture may be used for diagnosis of tuberculosis. Tissue biopsy through bronchoscopy can be done, as well as arterial blood gases may reveal the metabolic state of the patient, and particularly in this case respiratory acidosis or alkalosis. Pulmonary function tests are very useful in diagnosing restrictive and obstructive disease. Diseases of upper respiratory tract are one of the most common conditions patients coming and seeking care and treatment, not only in the United States, probably in worldwide. And the more climate colder, the more diseases of upper respiratory tract may be observed. So most disorders of this type are not life-threatening, as bad as patient feels. Upper respiratory infection is not life-threatening. It's caused by rhinovirus, and respiratory disease, upper respiratory disease caused by rhinovirus or a common cold virus, and the other name can be called as infectious rhinitis or common cold, or a viral upper respiratory infection. So most likely it's rhinovirus, but often other viruses such as adenovirus or influenza can cause it. But without focusing on the name of the organisms, there may be more than 100 different organisms that can cause, and this all leads to the fact that it's very hard to develop immunity. What happens? The organism will invade the mucosa and nasal mucosa, and leading to the nasal discharge and inflammation. Mucus production will increase, and shedding of epithelial cell will start. This is a first line of defense, increases the vulnerability to bacterial invasion. So this is bacterial superimposed invasions or infections, I would say, will occur when initial viral infection starts developing. Wet, cold, unsanitary condition can cause this, and URI can develop. The most common thing you need to know, and most important thing you need to know, that people will swear that of course this is cold, of course this is from the cold weather, of course this is from the fact that I got wet and I got under the rain and I got sick. So we need to know that the weather don't make you sick, truly. What happens, weather, especially in the case of upper respiratory infection, leads to the congestion of the people in closed spaces, either in their apartments, houses, workplaces, movie theaters. People spend or tend to spend less time outside. And in modern society, you would say it's really difficult to spend time outside anyway, but cold weather increases this, and so congested situation leads to upper respiratory infection. So how would you treat this? You will treat this with palliative measures. Palliative measures include rest, fluids, antipyretics, and analgesics. And antibiotics can be prescribed if a secondary infection occurred, and hopefully you don't have to deal with this. But again, upper respiratory infection, it's not a cause for antibiotic treatment, because most of the time it's a viral infection. So when we're talking about this, we can say it's common cold, acute rhinitis can be contrasted with allergic rhinitis, where we don't have a microorganism infection and it's a hay fever. In case of sinusitis, pharyngitis, and laryngitis, in this case, this may be an invader of a bacterial origin, and it may warrant the treatment by specific bacteria. In all the last three diseases, most likely patient will have facial pain in sinusitis, a sore throat in pharyngitis, laryngitis, and this also does not need to be treated by antibiotics immediately because this can have a viral origin. However, if the condition isn't resolving, it's possible to treat this with antibiotics. But again, URIs usually are not life-threatening, at least in the beginning, and usually the superimposed infections or sequela of this type of disease may cause the rather life-threatening situations, such as Streptococcus A laryngopharyngitis may result in valvular disease and of heart, and also be life-threatening, become life-threatening. But again, it's not the disease itself, it's sequela. Bronchi and lungs may be affected by invasive organism, and the rule of thumb is then you have to be more alert, you have to be more attentive, I would say. You have to be more providing more treatment to, more treatment is not the correct word, you have to be more alert to prevent life-threatening complications, and this is usually more severe. It can be superimposed or be a sequela of upper respiratory infection, or it can be it's having its own origin. Disease of bronchi and lungs and asthma is a allergic reaction. Basically, it's a hypersensitivity reaction that will lead to the bronchial constriction and spasm and will lead to difficulty breathing. When asthma occurs or asthma attack, wheezing sounds will occur, and dyspnea will happen. Severe episodes may require drastic measures and treatment. So how to deal with this? The best thing, the best intervention for asthma will be, as bad as it sounds or as difficult as it sounds, to remove the allergic factors, to remove the allergens and bronchodilator treatment. The juvenile asthma can be triggered by exercise, which the difference from adult asthma, usually exercise cannot be really a trigger of asthma. But again, in both cases, bronchodilators will be effective. Bronchitis, acute bronchitis, is most likely a sequela of URI. So URI sequela, it means you can determine that this is really a viral disease. Patient may have fever, tightness behind the sternum, substernal tightness, substernal chest pain, productive cough, productive yellow-greenish sputum. And if some people, another myth, another fallacy is when someone is having productive yellowish-green sputum, it's like even a healthcare providers who've been in the business for a long time would say, "Oh my goodness, this is bacterial. We need to throw antibiotics at you." In reality, most of the time, acute bronchitis, even with productive cough and sputum, is a viral infection. So antibiotic treatment truly will not be helping. And in this case, the palliative measures again will be helpful. And in some cases with acute bronchitis, the symptoms may last very long time, up to several weeks, but again, it's viral, it's not bacterial.